Now, I am the second speaker of the day, and for nearly 31 years, I have been dealing with the cognitive behavioral therapy. I heard the criticisms by Kemal, and my job is easier actually. In none of the CBT books those words were uttered. Just control the symptom. Thoughts and emotions are the same. Human beings is simple. Human is consisting of thoughts. Existential anxieties are not to be taken seriously. The therapist is superior to the patient and orients the patient. All the people are the same, and the culture is to be ignored. We need to avoid emotions. Negative emotions are unnecessary. None of these are being mentioned in CBT literature. What I feel is that, in general terms, in BDT or in CBT criticisms, everyone has a cartoon or prototype in their mind, and accordingly, they criticize. What I mean here is that the language in the sources indicated psychiatric disorders are defined in different dimensions. First of all, at high levels, we can handle them at social level or at molecular level. For the molecular level, we can handle the genes. The depression prone genes, transmitter genes, serotonin transmitter genes, etc. Or we can also handle it from neurochemical perspective. We can explain the disorders through the changes in the neurochemical messengers, and also at the mental level or psychological level we can explain these. At the behavioral level we can explain the disorders, or at the social level it's possible to explain. All these explanations are important and valuable, and while intervening the phenomenon or depression, we can intervene at all these levels. For some cases, certain levels may be prominent. This is valid for all the psychiatric disorders. But what about the treatment in our field, psychological or psychiatric disorder treatment? What should we do here? How to intervene here? One of the methods is psychotherapy. When we say psychotherapy, the psychological disorders or spiritual disorders are explained dominantly through conversations. And there are more than 500 psychotherapy methods, maybe 1,000, I do not know at the moment, but in the publications, in the textbooks, behavioral therapy, cognitive behavioral therapy, psychodynamic therapy, interpersonal therapy, humanistic therapy, and solution focused therapy are among the varieties of psychotherapy. But from whom to whom, when, for how long, and in which manner psychotherapy is to be provided, because it's related to human beings and their health. And of course, everyone will undergo what they want, but as the professionals, we need to have a perspective for psychotherapy. In the solution of psychological disorders, we use psychotherapy, but how we can shape it and how we can evaluate it. Our life practices, eating, drinking, roads, provinces, culture, and arts, should they be taken into consideration? There is the impact of history, traditions, moral, family, religion, culture, art, social environment, authorities, and also there is science in our life practices. When is the science necessary? In general medicine, if there is a method, for example, for a patient suffering from diabetes, an appropriate medication for the person's psychopathology must be found out, and an appropriate intervention is developed, and then you test whether it's effective or not. In the medication treatments, again, that we use in psychiatry, these are not intuitive, or we are not acting on personal opinion. The mode of the person, side effects, the body condition are all taken into consideration, and accordingly, through randomized control studies, case presentations, and also according to the meta-analysis, comprehensive meta-analysis we act on. And by certain groups, those studies are prepared as guidelines, and those guidelines help us to identify a treatment. And here, science is an applied science. Clinical psychology, medicine is an applied science, just like clinical psychology. And whether we like it or not, whether we criticize it or not, there is a positivist paradigm. You find a method, you observe, and as a result, you come up with an hypothesis. You test that hypothesis. As a result of that test, if the method or your theory works, you do a practice, an application, and with a new explanation, with a new assumption, a new hypothesis can be derived, which will fill in the gaps of the previous one, and then your practices will continue. Today, we send missiles to the space, or we obtain nuclear power from atom, etc. And the physical world, it really works well. Science is a discipline which provides the functioning of the universe through tests, and it's the whole of the applied and theoretical information. And science is science if the information is possible to test. Therefore, what does a science do? There's a definition, objective definitions for the cases. It understands the cause and effect, and there is a reasoning, identify the regular functions, and there is control for the possible phenomena in the future. And rather than a content, science is a way of thinking. And in that sense, CBT can also be handled as a method rather than the content. Therefore, it's a perspective to look at the psychological problems and the solutions. That content may change, but the method itself matters. Now, psychotherapy is also handled by a group of people, starting with behaviorists and back starting from psychoanalysis, applies this older psychotherapy, and he thinks that the scientific method is the most appropriate one, and behaviorism is handled from a scientific perspective, and this is applied to the scientific content and psychotherapy. Why is that so? Because Beck developed that moment at that time, because various interventions can be done for the mental health of human beings. People may change after a book, after friends, talking with friends, but as a method, there should be a basis that psychotherapy should be on. And in the applied sciences, the most robust method is the scientific method. Not because this is perfect, but it is the best method available to us at the moment. Science cannot answer every question. The method of science is superior to the other methods in applied fields, but it cannot be applicable for all the fields in life, like what is the meaning of life, etc. But these are not the topic of science, but it's the topic of philosophy and spiritualism. And freedom is the most significant matter in life. This is not something to do with science, or the best author in Turkey is Orhan Pamuk, or lying is a bad thing. These are also the topics of moral or literature, etc. Psychological state affects the cause of cancer. This is something related to science. According to the cognitive behaviorist theory, the reason for the psychological disorders is the bad mood or negative emotions. I do not know whether you know this Star Trek series, and Mrs. Spock here is coming from Voltron planet. He has green blood. He is made up of ration, no emotions. And when there is a spiritual emotional state, he comes up with some rational solutions. This is just like an Asperger's syndrome, and he says that crying is not the solution. This is wrong. What's the correct manner? Now, the CBT is the general name for the psychotherapies based on psychology, and dominantly CBT and cognitive psychology principles are the basis for the psychotherapy. And depending on these principles, psychotherapeutic methods help person to change the cause of the emotions or negative modes of the people. In that sense, psychological problems are emerging due to the interaction of the environmental, cognitive, emotional, physiological, and body or behavioral factors. However, our perceptions and behaviors have an important role in the continuation of these factors. If we can intervene in this and if we can change this may alleviate the problem. And this intervention has the only option to be cognitive and behavioral. If you talk to somebody and that person understands you, there's a scientific process. And after this, if there's an emotional change and behavioral change, this is again the same process. Any therapy, as also mentioned by Kemal Bey, existential, just like as such, if they do some change in your life, it is a process change. And this is a CBT. There is no other chance for this. But what is the difference of this CBT? While doing this change, we need to be aware of what we do. And regarding that field, I mean, what is psychology? Science. It is the science on the thoughts, behaviors, and attitude, and they can be changed through certain processes. But our profession focuses on science because we are dealing with applied sciences, and this is the field that we work in. In the end, our psychological reactions are shaped by the culture, society that we live in, or our reactions and emotions and their interaction shape it. And here, in which fields do we intervene in the medication? For example, brain is the organ for emotions and thoughts. We administer some medication. They are in the blood and they move to the brain, and we have some effects of this. And psychotherapy is the second method. And here we add any parameter in the surroundings of the person, and especially we intervene in the perception, thoughts, and behaviors, which is valid for every therapy. Now, when we talk about the CBT, there are some waves. The first wave is traditional behavioral therapies, exposure, classical conditioning based therapies, followed by the second wave, Alice and Back therapy, and then comes, as mentioned by Kemal Bey, the third wave, CBT therapies. And whether how was the therapeutic relations were like when Beck put forward this idea for the first time? This is the first manual written by Beck. For the first time, it tells about the psychotherapy method. Tajuddin may know that our professor Haluk was dealing with psychotherapy, and let yourself to the flow and accordingly develop your roadmap according to the patient, he was saying. But we couldn't understand those when we were residents, and behind the doors what was happening in psychotherapy we didn't know at that time. And for the first time the details of the psychotherapy were told in these manuals, and it was in 1979. And the first three chapters of the book, nearly 60 pages, were bought after the general introduction. Chapter 2 starts with the role of emotions in cognitive therapy, followed by the chapter 3, the therapeutic relationship in CBT. It is not something newly discovered. From the very beginning of the therapy, the therapeutic relationship is something necessary for achieving a change in CBT. If therapy is a meal served to the patient, the therapeutic relationship is the plate that the meal is served on. This is a chapter from that part, the considerations while applying CBT. Sliding the therapeutic relationship. The novice therapist often becomes so enamored of the techniques that he forgets the importance of establishing a sound therapeutic relationship with the patient. Interpersonal problems with the patient present one of the most common problems of therapists, which are ignored. Therefore, the therapist must never lose sight of the fact that they're engaging with another human being in a very complicated task. And we shouldn't forget that it's complicated, and the emotional expressions of the patient must be encouraged, and also the communication style of the patient must be considered, and it goes on. And being stylized, capricious, and overly cautious. Third item is being overly reductionistic and simplistic. These are the titles of the items. Many of the people think that CBT is something to identify the negative thoughts and just correcting them. However, it is a cognitive model of emotional disorders. It's forgotten. And being overly didactic, overly interpretive, and or being too superficial, or reacting negatively to the depressed patients, not accepting the patient, and accepting the intellectual insights, etc. Now, the therapists and our in order to evaluate our capability to apply CBT, there's a scale, and there is a CBT academy to which I'm a member, and the person undergoes a training, and a golden cassette is a golden video, let me say, is submitted, and accordingly we evaluate that person. There is this is a scale of 11 items, and the first 5 is about general therapeutic relation, the common purpose, the feedback, what did the patient feel, what did he understand, and did the therapist understand the patient, the efficacy of human relations, and common grounds, cooperation. These 5 items are generally related to therapeutic skills. But what's the difference? The difference is in applied sciences, applying the method of applied sciences to the psychotherapy. If you are dealing with depression, you observe depressed people, and then you see that at the cognitive level, negative events, incidents are more perceived and remembered by these people. At the behavioral level, the positive stimuli has a decrease, and penalties have increased in the life of these people. And then you test this theory with empirical studies, and then you try to find solutions to increase the positive stimuli and reinforces for those people, and also how we can minimize thinking of the negative incidents and effects from the past. And you develop such a protocol benefiting from psychology, and then you test this through randomized clinical studies, and then you spread these treatment protocols. In the CBT studies of today, we have a control group is necessary. As Hakan, I developed a method X, for example. In the first study, I cured 99 out of 100 people. In the second study, I cured 95 out of 100 people. But I cannot say that this method was quite efficient. But was that the curing point was my method or some other thing? That in order to compare this, you need to use a placebo of psychotherapy. Now all the studies are like this, involving a control group. For depression model, for example, there are 19 studies which support the negative bias tendency in perception assumption, and there are at the more speculative level for the schemas, 30 the assumption was supported by 31 studies, and there are also data not supporting the same assumption in 6 studies. Again, in 2013, there was a meta-analysis on depression, and 115 CBT was applied, and the impact field was 0.71, which means that compared to the control group, the efficacy of the treatment was much better, 0.71 times much better. And this is the Dodo verdict is one of the greatest legends, and here the logic is that the story of dodo bird is like this. There's a circle, and the animals compete within that circle, and in the end, dodo bird says that everyone wins, and everyone will be awarded in the end. And first, it was used by Rosenweg in 1936, and the logic behind this is as follows. And it doesn't matter which therapy is, psychotherapy helps people. So one common point is that going to the therapy and therapeutic relationship, not the method, but the therapeutic relationship is important, he says. Therefore, regarding the efficacy of psychotherapy, there was no research conducted at that time, and all the psychotherapy methods he exemplified were the variants of psychotherapy in 1936. There was also a meta-analysis conducted by Smith and Glass. Behavioral and non-behavioral therapies were compared. In that meta-analysis, in cognitive therapy, the cognitive therapy was also among the non-behaviorist therapies, but they compared the apples to the pears. Therefore, they compiled all the CBT and psychotherapy studies, and in a pool they compared all. However, for different disorders, there are different impact levels, and they should be compared separately. From general medicine, I can give you an example. When there's an infection, you administer antibiotics to people, and they heal. An antibiotic matters here. So for an infection, any antibiotic can be prescribed. And this is the logic in this meta-analysis.
Well, I was talking about golden standard. So why is CBT the golden standard in psychotherapy? First of all, it's a scientific method. It's a scientific method. When there are only a few studies regarding other types of psychotherapies, the number of studies concerning CBT is hundreds. So we have more data when it comes to CBT. Systematically, it wasn't proven to be the dominant approach, though. Regarding human behavior, it is also in compliance with main paradigms of psychotherapy. Here we see the concept of evidence-based psychotherapy for the treatment of mental disorders, reaching out to conclusions through scientific methods and using randomized studies is the basis of this approach, which contributes to the development of psychotherapy in general. As a result, through experimental methods, therapies were also supported. APA, American Psychological Association, has 12 criteria for experimental studies, and accordingly, if the sample size is sufficient, the two-group studies are more effective to placebo, including studies. And CBT proves to be more effective among the studies conducted. The best category is the first category from scientific point of view. If you take a look at the psychotherapy categories, you see CBT comes first as the most effective approach. And the second one is EMDR. The exposure side and the cognitive restructuring are the most effective dimensions of CBT. EMDR comes second. Psychodynamic therapies of course, there are certain studies and results, but the number of collected data is not sufficient to prove it effective at all cases. Cognitive behavioral analysis system of psychotherapy and the New England Journal of Medicine. In this journal, a study was published. Accordingly, 681 adults with a chronic non-psychotic major depressive disorder, they were randomly assigned to 12 weeks of outpatient treatment with nefazodone, and the remission was defined as a score of 8 or less at weeks 10 and 12. For patients who didn't have remission, we see there was a reduction. So when we take a look at the results, among the 519 subjects, the response were 55% for the group who took the medication. So according to the result, 1,510 patients were included in the study, and antidepressant combination was more dominant. CBASP was compared with psychotherapies, and a significant difference was found, and the impact was similar to antidepressants. You see the total average on this graph. Another study shown by Professor Kemal, it was published in 2023. Kulpers studies meta-analysis very often. Kemal actually skipped one part, which is CBT was found as significantly more effective compared to other psychotherapies, and CBT was more effective in short term. But during the 6 to 12 months follow-up process, the significance was not as effective as pharmacotherapies. There is not another psychotherapy that can be assessed in the same manner. CBT was more effective in the short term, but when it comes to long-term studies, pharmacotherapy was proven to be more effective. The effect size changes depending on the duration, according to Kupers. So it's actually up to your perspective and from which dimension you look towards studies. Regarding panic disorders, Clark made a study in 1994. In the first year, patients did not relapse, therefore, they didn't publish the study as it will not be convincing for the people. They waited for the patients to relapse to publish the results. So, the treatment of panic disorders, when we take a look at the guidelines, APA Division 12, we see CBT therapies is suggested. This is the guideline of the UK in panic disorders. Psychopharmacology is used. I don't want to go into detail of this. Well, I want to underline that all people are equal, but not all psychotherapies. In 2010, Tollin made a meta-analysis, including 26 studies. CBT, both in the acute period and in the follow-up period, was dominant compared to other psychotherapies. Psychotherapies are not equal, as I said. Some are based on assumptions, pre-scientific period assumption, and this is classical psychoanalysis. Right now, this is contradicting neurosis, for instance, actual neurosis. Such approaches are contradicting with our current scientific approach, for instance, withdrawal in sexual relationships. These are all considered as some subjects of neurosis, but this is contradicting with the scientific view today. Some explanations, especially explanation of reasons, are not scientific, are not of scientific nature. For instance, sometime with social anxiety, feels anxious speaking in public. So according to the psychoanalytical approach, this person has a desire, aggressive desire to expose himself or herself, which causes shame. Or another person with compulsive shopping tendency actually was castrated, and this woman tries to replace the castrated penis according to psychoanalytical approach. Some psychotherapies are not related with biology, such as Reiki, EFT, etc., NLP, for instance, or energy therapies, while some others, when scientifically tested, are not very genuine, such as EMDR, but some others are effective, such as CBT therapies and others. So finally, as I wrap up my presentation, I want to make an announcement. The first one is a certification training. It will be organized between the 3rd and 5th of May in Limank Ambassador Hotel in Ankara. It will last 2 years. The first training will be given in May. Again, another training will be given in October, 3rd and 6th of October. We have CBT Psychotherapies Congress. Burkon Tourism Agency will organize this event as well. So you're all welcome to join, and thank you very much for your patience.